Congestive Heart Failure Warning Signs You Shouldn't Ignore by Robert Autry, MD, MSc. Welcome to HeartyHealthMD. Today, we are discussing a critical condition that affects millions heart failure. Despite the name, heart failure does not mean the heart has stopped beating. Rather, it is a progressive condition where the heart is unable to pump oxygen rich blood to the rest of the body efficiently. The basics of heart anatomy. To understand how heart failure happens, we first need to look at how a healthy heart functions. The heart is divided into two sides, right and left, and contains four distinct chambers. The top two chambers, called the atria, receive blood, while the bottom two chambers, the ventricles, are responsible for pumping blood out. The process works in a specific loop. The right atrium receives deoxygenated blood, or blood low in oxygen from the body, and sends it to the right ventricle. The right ventricle pumps that blood into the lungs to receive fresh oxygen. The left atrium receives the newly oxygenated blood from the lungs. The left ventricle, this is the heart's major pump. It squeezes the oxygen-rich blood into a large blood vessel called the aorta to feed the rest of your organs. What is heart failure? Heart failure occurs when there is pump dysfunction, where the ventricles are too weak to pump, or impaired relaxation, meaning the heart muscle has become too stiff to fill with blood properly. Because the left ventricle is the primary engine for circulation, most cases of heart failure involve this chamber's inability to squeeze blood into the body. A key metric cardiologists use is the ejection fraction, or EF, which reflects how much blood the heart squeezes with each heartbeat. With every heartbeat, a healthy heart should squeeze out about 55% of the blood within it. When this percentage drops, or when the heart cannot relax to receive blood, it leads to the retention of extra fluid in the body. This condition accounts for approximately 8.5% of all heart disease deaths in the United States. Two main types of heart failure. We categorize heart failure into two primary types based on the left ventricle's performance. Heart failure with reduced ejection fraction, or HFrEF. This occurs when the heart muscle is weak and cannot squeeze blood effectively. It is defined by a left ventricular ejection fraction, or LVEF, of less than 40%. Causes can include coronary artery disease, viral infections, alcohol use, or genetic factors. Heart failure with preserved ejection fraction, or HFpEF. In this case, the heart still squeezes more than 50% of the blood out, but the heart muscle is stiff and cannot relax properly after the squeeze. This is frequently seen in patients over the age of 60 and those with obesity, diabetes, or high blood pressure. Recognizing the symptoms. Early detection can save your life. Common symptoms include shortness of breath. This may occur during exercise or even while resting. Sleep dysregulations, feeling the need for extra pillows to breathe or waking up gasping at night. Physical changes, swelling in the lower extremities, legs, or the abdomen, often accompanied by rapid weight gain from fluid retention. Fatigue, persistent tiredness or wheezing and coughing. Diagnosis and modern management. Diagnosis is primarily clinical, relying on your symptoms and a physical exam. We also utilize electrocardiograms, or EKGs, to assess the heart's electrical system, and echocardiography, or echo, an ultrasound that uses sound waves to see exactly how the heart muscle is moving. Management has advanced significantly. For HFrEF, we use 5 main classes of medications. Diuretics, to help you urinate out extra fluids from the lungs and legs. Blood pressure control, medications like Entresto or lisinopril. Beta blockers, to reduce the heart rate and workload. Mineralocorticoid antagonists, like spironolactone, to reduce heart scarring or fibrosis. SGLT2 inhibitors, such as empagliflozin, which significantly improve survival rates. For HFpEF, the focus remains on diuretics, blood pressure management, and SGLT2 inhibitors to keep the heart functioning as well as possible. Thank you for watching. To learn more and live healthier, find us at HeartyHealthMD on YouTube. If you found this helpful, please like, share, and subscribe to support your heart health.